This is Dr. Eric Lund, your Roseville neck and back pain relief chiropractor. Low back and hip pain, is it nerve, muscle, or joint? How to tell? So these are important questions because how you treat your pain is dependent upon what you find out. So let's try to narrow down what's going on and what's causing your pain as far as low back pain, hip pain, pain down the leg. So the first thing is joint pain. What are the joints that could be causing pain or the pain is coming from? So the first one is facet joints, and many people are not aware of facet joints, but what they are is that you have two of them on each segment of the vertebra, from your low back all the way up to your neck. And so there's 10 facet joints in the low back, and basically it's these joints right here, and they have movement and motion. And so these joints, they can wear out and have degeneration or have arthritis, and that can give you pain. And so when these joints wear out, again, that can cause pain. And when you flex forward, these joints will open up, and when you extend back, they jam together. So a simple test that you can do to assess whether the pain is coming from facet joints is number one, it's going to be more localized lower back pain, but then you can extend back and go over and back to one side, and you can do that on both sides. And if I have someone in the office, sometimes I'll even compress down a little bit, and if that increases or causes your pain, a facet joint could be what is causing the low back pain. Another sign is that oftentimes with facet joint pain, you'll have localized pain. So let's say it's on the right side. People will lean to the left, away from the painful side, to kind of open up that joint that could be jamming, and it could give you some relief. So that's kind of the pain patterns of facet joints, and a test that you can do to assess whether facet joints are responsible for the low back pain. The second joint that I want to talk about is the SI joint, or the sacroiliac joint. And what that is it's a joint of your pelvis, and basically you have the ilium and the sacrum, and so then hence you have a sacroiliac joint on the left and a sacroiliac joint on the right. And the SI joints can generate pain. Now typically if you have an SI joint pain, the pain is going to be pinpoint right within the SI joint on the right or the left side, depending on where your pain is. Now oftentimes what happens, or a common mechanism of what tweaks an SI joint, is I'll have a patient come in and they say they stepped off a curb and wasn't expecting it, or they were walking and they hit an uneven surface that they weren't expecting. And then that tweaks the SI joint. So typically you have the localized pain. The pain can travel into the leg, but it's going to stay above the knee, and the pain is not going to be a numbness or a tingling type of discomfort. The test that you can do to assess the SI joint is, I'll lay down and show this to you, but basically you're going to cross your leg over here. So you're going to basically put your foot or your heel on your opposite knee. And so you lay down, and then you can kind of push down a little bit. And if the SI joint is irritated and causing pain, typically that test is going to put more pressure on the SI joint and cause increased pain. So again, that's the SI joint, some of the pain pattern, and then tests you can do to see if the SI joint is what is causing your lower back, hip pain, or leg pain. The third thing we want to discuss would be kind of a disc or a pinched nerve. And so if you have pain that travels, from the low back through the leg, but especially past the knee and to the foot, and it's more of a numbness and a tingling, this could be a pinched nerve from one of two things. It could be a disc, or it could be a piriformis muscle that's tight. So let's first discuss the piriformis muscle. So the piriformis muscle is a muscle that's located in your butt, and the muscle is close to the sciatic nerve. And so if the piriformis tightens down over the sciatic nerve, this can cause leg symptoms, okay? Now, one of the things that commonly happens with a piriformis syndrome is you don't have lower back pain, but you just have leg symptoms. And those leg symptoms, again, are going to be more likely numbness and tingling. They're going to go past the knee and possibly into the foot. Now, a disc bulge or a disc herniation can also cause leg pain. Now, typically, if it's a disc issue, you'll have some lower back pain. You'll also have the leg symptoms, and certain things like sitting, bending forward tend to make the pain worse. But there's also a test that you can do that's called the slump test. And basically, what you want to do is we want to get in a real poor posture where we're slumped down. We're going to tuck our chin, and then we're going to extend this leg out and then bring the toe up. So basically all I'm doing is I'm going to extend this leg out and bring the toe up. So you're slumping down, knee to chest, extend the painful leg, and then bring your toe towards you. And now typically this is going to cause a stretch in the back of the leg, but if there's a disc issue, typically this slump test is really going to fire up and worsen the symptoms in your leg. So that's a good test to determine if a disc is more likely causing the low back, the hip, and the leg pain. So, and then lastly, muscle. Most of the time it's not going to be muscle directly. If it is, this is going to be more localized pain, no leg pain, tenderness to the touch. But again, most of the time with low back, hip, leg pain, one of those joints is going to be the main reason for the pain. So hopefully this helps with the explanation of the potential pain patterns with each joint, and then some tests that you can do to assess that. Okay, and the good news is that chiropractic treatment can help treat pain, whether it's from the facet joints, the sacroiliac joint, the piriformis muscle, or a disc. So if you're in pain, I can see you today. I'm in the office Monday through Thursday, 8 a.m. to 6 p.m. I provide same-day appointments and same-day treatment, and there's a high likelihood that I can help reduce your pain today. I don't give any long-term treatment recommendations or plans. The treatment is based on your level of pain. So when you tell me that you're out of pain or close to out of pain or have reached maximum benefit, that's where we're done with treatment. You can come back in the future if you need to. So if you'd like to be treated today, call me at 651-779-5998. This is Dr. Eric Lund, your Roseville neck and back pain relief chiropractor.